Guys, for the dissection, we're gonna have these instruments and then we're gonna have the specimen. Be very careful because you can have an accident with these sharp instruments. Be very careful, guys. You need to orientate the heart using the apex. Remember, this is the left part and this is the right side of the heart. You need to set the heart for the ventral surface. This is going to be the interventricular sulcus, and then regarding this sulcus, you're going to make an incision. It's going to be right here, 1.5 centimeters to the left, and you have the left side and the right side, left ventricle, and you have the sulcus right here, and you're gonna cut 1.5 centimeters from the sulcus to the left first. You're going down parallel to the sulcus, and then you're doing a second incision to meet this one. These structures are from the right side. Here's the moderator band. This one is the moderator band. Be careful not to cut this one or these structures. On the left side, you have another incision. You have to make another incision. It's going to be again 1.5 centimeters from the interventricular sulcus. Remember, this is a fresh heart. Yours is going to be kind of harder, and it's going to be juicy because of the formaldehyde. And you can complete the cut in order to analyze the structures inside the heart. Try to fix the walls against the tray, and it's going to be easier to identify these structures. You can fix to the tray your right ventricle and right auricle, and you can fix to the tray your left ventricle. Inside the heart, we're going to identify the wall of ventricles. This is the left ventricle. As you can see here, it's a thicker wall. This is the myometrium of the left ventricle. This is the left side. This is the left ventricle. This is the wall. You can see here the papillary muscles pulling the chorda tendineae, and this is the valve, AV valve, mitral in this case because it's the left side. You can see here the striations of the cardiac muscle, and these thicker lines here are the intercalated disc, striations and the intercalated disc. Then you can see here in this model the the right auricle, and this is the interior of the right atrium. You can see here the interior of the right ventricle. Here you can see the papillary muscles pulling the chorda tendineae. And this is the chorda tendineae. This is trabecular carne, which is part of the wall of the ventricle, trabecular carne. This is the moderator band. You can see this is different from the one you saw in the video, in the previous video. Moderator band. And this is the endocardium, which is the inner lining of the heart. Endocardium. This is the ligament between the aorta and the pulmonary trunk. This is the Ligamentum Arteriosum. Ligamentum Arteriosum. In this model, this is the right atrium. This is the right atrium. And this is the outer part of the atrium. This is the auricle. It seems like a dog ear. This is the right auricle. These are veins, the superior vena cava. And this one is the inferior vena cava. This one is the coronary sinus in order to drain the blood from the heart. This is the coronary sinus draining on the right atrium, draining the blood from the heart. This is the interatrial septum. This is the septum between auricles. This is the interatrial septum. Then you have here the tricuspid valve. This is going to be the tricuspid valve, which is the valve between the right atrium and the right ventricle. We have here the right ventricle. This one is the septum between ventricles. It's the interventricular septum. And this one is the origin or the division between the pulmonary trunk and the right ventricle. This is the semilunar valve. And this side is the right side. This is the pulmonary valve. Here you have the pulmonary trunk. And we're going to have two pulmonary arteries for the left side and the right side. Then we have the left atrium. The left atrium, and we're going to have the outer side is going to be the auricle. Remember, like a dog ear, the auricle of the heart. These four are the pulmonary veins. They're carrying oxygenated blood to the heart. Pulmonary veins. This one is the AV valve on the left side. This is the mitral or bicuspid valve. Then we have the left ventricle. And then we have these valve between the left ventricle and the aorta. It's called semilunar valve. This one is the aorta. It's the biggest, the largest artery in our body. This is the ascending part, this is the loop, this is the descending part. Regarding the cardiac circulation, we have the coronary arteries are branches of the aorta. Now we have regarding the cardiac circulation, is going to be the coronary system. And you can see here the anterior view. This is going to be the left coronary artery, which is branch of the aorta. And this left coronary artery is going to be here, right here. This is the coronary artery, and this is one branch. It's going to be the circumflex artery. And that is going to be for the myocardial capillaries in the walls of the left atrium and left ventricle. This is the anterior interventricular artery. The anterior interventricular artery. And this is the right coronary artery. Right coronary artery. This is a marginal artery. It's going to be branch of the right coronary artery, and it's for the myocardial capillaries in the walls of the right atrium and right ventricle. And this is the posterior interventricular artery. And this is going to be for the myocardial capillaries in the ventricular walls. And this is the great cardiac vein in order to recover the blood, deoxygenated blood from the heart. And this is the middle cardiac vein. And they're draining on the coronary sinus. They're going to be draining on the coronary sinus, and the coronary sinus is going to be draining in the right atrium. The coronary sinus, which is this one, is going to be draining on the coronary sinus, going to be draining on the right atrium.